Good evening. This is Sarah Wellhausen reporting to you live from Washington, D.C. with up-to-date information from the Federal Emergency Management Agency, better known as FEMA. We have received word that a flu vaccine distributed to 21 states in the Midwest and Northeast regions of the United States has been found to be hazardous and causing adverse effects. These states include Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, Indiana, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, Kansas, North Dakota, and South Dakota. Of these states, 9 have reported illness. What we know at this point in time is that half of the doses of the synthetic vaccine have been found to mutate when coming into contact with the body's T cells within 30 days of injection. T cells play a key role in the body's immune system. Unfortunately, there is no way to know precisely where these doses were distributed or how many have already been utilized. But at this time, the Centers for Disease Control, CDC, has ceased distribution of the vaccine in question, along with placing a recall on all remaining doses of the vaccine. At this stage, it is recommended to people in these states that have received a flu vaccine between October 1st and December 15th today to report any adverse symptoms to their health care provider or local nurse hotline. Notable symptoms include vomiting, diarrhea, fever, and severe headache. The CDC has also established a temporary hotline for this specific occurrence and can be reached at 1-800-867-5309. If you or someone you know received a flu vaccine and are experiencing any of these symptoms, it is imperative that you report them as soon as possible. If victims go unmonitored, results can be fatal. Within 3 to 5 days of these initial symptoms, the mutated vaccine attacks the nervous system, causing paralysis and/or death. Each year, millions of Americans are affected by seasonal influenza, an infectious disease caused by influenza viruses. It is recommended by the CDC, World Health Organization, and medical professionals for children, adults, and the elderly to receive a yearly flu vaccine in order to remain safe from the virus, especially during the winter months when the flu virus is most active. According to the Centers for Disease Control, while the impact of influenza varies from season to season, it places a substantial burden on the health of the people of the United States each year. The CDC fights disease and supports communities and citizens to do the same. It remains unknown at this time why this particular batch of vaccines mutated, but the CDC and FEMA are working diligently with state and local officials to manage the situation in a safe and timely manner. To review, if you or someone you know living in the Northeast or Midwest regions of the U.S. received a flu vaccine between October 1st and December 15th and are experiencing vomiting, diarrhea, fever, and/or severe headache, please contact your healthcare provider, local nurse hotline, or call 1-800-867-5309 to report your symptoms and receive further instruction. Thank you for tuning in. Be well and stay safe.